So we're looking at what is known as neonatal jaundice. Alright, of course, jaundice is something that we have discussed so much. Jaundice is just all about bilirubin levels are high in the body. So the sclera of the eye is yellow, the skin is becoming yellowish. You understand all of that? So for neonatal jaundice, we're just saying it's a common condition in newborns. Okay, this is where their skin and eyes are becoming yellow. Why? Because bilirubin levels are so high in the body. Can you see the skin? This one is just the head and neck, it's becoming yellow. This one is the head and trunk. This one the trunk and maybe your forearms. Do you understand? This is just trying to show the severity of jaundice in babies. So bilirubin is a yellow pigment that is produced when red blood cells are broken down. So in a normal human being, red blood cells stay up to 120 days. So even if they are broken down, you just have little bilirubin coming up. But in a baby, in somebody whose red blood cells are being broken down so much, this bilirubin can accumulate. So now you might want to now start thinking about what conditions will make red blood cells be broken down so much. Of course, one of it could be that if the mother's blood was not compatible with the baby's blood, that's rhesus factor incompatibility. So it would have led to what? The immune system of the mother attacking the baby. So what are the types of neonatal jaundice? You can have physiological one. This one is just normal. Why? The baby, when the baby was inside the abdomen, their red blood cells, were not, staying up to 120 days. Do you understand? So after you give birth to the baby, there are one or two adjustments here and there. Do you understand? So it's physiological, it's normal. Then breastfeeding jaundice is caused by insufficient milk intake in the first week. Breast milk jaundice, this is due to substances in breast milk that affect bilirubin metabolism. Then pathological jaundice, this one appears within 24 hours of birth and persists between 2 to 3. Anytime they say pathological, it's a disease condition. I've explained that disease condition. So it could be that the baby has infection. Hemolysis, this is where immune system of the mother is affecting the baby. Maybe it's liver disease. Alright, so causes, it could be that immature liver function. Alright, blood incompatibility, rhesus factor or ABO, birth trauma, genetic disorders, infections or metabolic conditions. Alright, so symptoms, the baby is having yellowing of the skin and eyes. Poor feeding, they don't want to feed very well, excessive sleepiness, dark urine, and the stools are pale. That's to show you that jaundice. So diagnosis: transcutaneous bilirubin test. Serum bilirubin test, you want to check the bilirubin levels in the body. Additional tests, you just want to spot out maybe there's any reactions, like home test, liver function test, genetic screenings, and all of that. How about the treatment? You do phototherapy. That one is light. Use some specialized blue light to break down bilirubin in the skin. Exchange transfusion. That one is where you spot that antibodies are there. So you now kind of like change. You replace the baby's blood. As you are taking it out, you are putting new one. Frequent feeding and monitoring.